Hello, welcome to this edition of Iron Port. It is proudly brought to you by Ghana Community Network Service, Gold Company Limited, West Blue Consulting, Ghana Revenue Authority, as well as the Serene Insurance Company Limited. Our media partner is the Business and Financial Times. This week, we look at the fight against COVID-19 and public health threats, the role of the International Maritime Health Facilities. Before we bring you what transpired during our live panel discussion, let's take a look at the International Maritime Hospital's role as a maritime health facility before and during the era of COVID-19 in the following piece.
The International Maritime Hospital, which was established by Ghana's Ports and Harbours Authority, is the only maritime health facility in the whole of Africa. The 130-bed ultra-modern tertiary hospital with state-of-the-art medical facility is located in the harbour city of Tema in the Greater Accra region of Ghana and augmenting healthcare delivery services nationally and internationally, as well as serving the thriving maritime industry within the region. It has been described by many professionals as arguably one of the top 3 health facilities in Ghana. It has a dialysis center, a surgical unit, an obstetrics and gynecology department, an orthopedic department, among others. The imaging section of the International Maritime Hospital boasts of a 3 Tesla MRI infrastructure. The modern facilities at the disposal of the International Maritime Hospital, coupled with a range of specialist healthcare professionals, help deliver effective, efficient and patient-centered care to clients of a variety of health conditions from all walks of life. Since the outbreak of COVID-19, the International Maritime Hospital has instituted various strategies to prevent the importation and spread of the virus, including sensitization and education.
It's a new virus, so we are still discovering it. We don't even have a vaccine yet. We don't have any specific treatment for it yet. Research is still now ongoing about COVID-19.
IMaH'S has also introduced the telemedicine service, which gives clients of the hospital remote access to healthcare without needlessly putting themselves at risk to be physically present at the health facility due to the volatile spread of the coronavirus.
We've opened up an e-consult for IMaH'S clients where you don't have to come into the hospital, but we can still see you online through a telemedicine platform.
The International Maritime Hospital, although not a designated treatment center for COVID-19, has been able to play a pivotal role in the handling of first-hand suspected cases and effectively handling them before transferring them to treatment centers. The international community has also found hope in IMaH'S as the hospital of choice, especially in this era of COVID-19.
Now to the main discussion on looking at the role of the International Maritime Health Facility in fighting against COVID-19 and public health threats. We engaged 3 key doctors of the International Maritime Hospital, including its CEO. Please take a listen.
The Chief Executive Officer of the International Maritime Hospital, Dr. Sylvester Yao-Opong, has stated that the International Maritime Hospital is well positioned to help solve some of the health concerns of members of the international trade community who find themselves in Ghana for business.
When people are doing business in Ghana in the port space, they will also be comfortable if there is a facility that will see to their healthcare needs, especially in times of emergency. And in that respect, IMaH'S is particularly well placed.
Speaking on Iron Port's panel discussion on the role of international maritime health facilities in fighting public health threats like COVID-19, the head of IMaH'S revealed that one of the principal motives for establishing such a world-class hospital to complement operations of the Ghana Ports and Harbours Authority is to strategically position Ghana as the gateway to West Africa in terms of trade.
I think that, you see, when people are entering the country, foreigners, one of the things that make them very uncomfortable is the health services in that country. Foreigners here, some of them, when they are coming, they are very apprehensive that if I get a heart attack, where do I go? Do you have facilities that can take care of me?
Dr. Opong asserted that currently many within Ghana's ports and maritime industry, including foreign nationals, seek healthcare from the International Maritime Hospital, with the expectation of increasing the numbers considerably due to the variety of specialist healthcare services offered.
If an agency, even if they don't want to enroll all of their staff, they make sure that the expatriate staff have access to IMA because of the level of healthcare and then the standard they are happy with. So I think that going forward, the development of the port, Tama Port and all that, the presence of the International Maritime Hospital will make foreigners coming in feel more comfortable, more secured, and then the level of healthcare that they are used to, wherever they are coming from, they are likely to get.
Dr. Helen Tete, the head of clinical services of the International Maritime Hospital, also said IMA has been readily positioned to help keep the gates of the country away from the importation and spread of public health threats, and has, since the advent of the COVID-19 pandemic, collaborated with the GPHA clinic and the Port Health Unit of the Ghana Health Service in that regard.
We've had several interactions with them, and so if there is anything like that, the first point of call is the Port Health. But then they know that if there is any client they need to move for treatment because of the connection with us, we are available to take care of the patient.
Dr. Tete, who is also the consultant anesthesiologist at IMA, revealed that even though IMA had to remodel a lot of its healthcare services since the advent of COVID-19, it has been able to effectively collaborate to handle first-hand situations associated with the COVID-19 before transfer is made to the designated national treatment centers.
Once we are doing that, we also test our inpatients. So if somebody comes and the person comes with any condition, we suspect that this is COVID or has other things associated with it. So like as CEO said, we have an isolation place where we hold the person, take the sample, continue to treat you until the results come. And we've done several of those since this pandemic.
Dr. Yaichan Boateng, a family physician specialist at IMA, disclosed that the international community in Ghana have found solace in IMA due to the professionalism of the health personnel, as well as the host of specialist care services at the disposal of the facility, making it a one-stop shop.
And then also we have people speaking, we have doctors that speak Russian, we have doctors that speak Chinese, we have people that speak French. So I think when they come in, and there are some, they speak these foreign languages, they are happy. Then when COVID broke out, if you were Chinese or Asian, all of a sudden, any hospital you enter, you are in trouble. Yes, some stigma. We don't stigmatize.
She added that the intensive sensitization campaign embarked on by the staff of IMA using local dialect aimed to reach a wide range of audience with useful information.
IMA has come up with all these videos in different languages to help some of the Ghanaians who do not understand English, so that they also know that, yes, there's really something out there called COVID-19. Maybe there's the English videos they don't understand. So we've made something for them in the local dialects so that they would also really get to understand that, yes, coronavirus is real and they also need to protect themselves.
The family physician specialist emphasized the hospital's pragmatic telemedicine program, which allows clients remote access to healthcare.
So here people are able to come online and meet your doctor, have a consultation and get your treatment, and you go on with your life.
She said the initiatives have been well received by the general public. The CEO of IMA, Dr. Yao Opong, added that although the patient attendance have generally reduced, its conducive mortuary facility remains attractive to clients.
Luckily, after the lifting of the lockdown, we had a few people coming in to collect bodies for private burial. And that dropped the number a bit, but only for us to get a lot more to virtually fill it to capacity. We also have a hall within the mortuary itself. We have a hall that people can hold just small church service.
Dr. Yaichan Boateng explained how beneficial pragmatic measures have been to protect the lives of health workers at IMA as well as clients.
They think maybe they've been infected, that's why they want to test. Some too just want to know their status. But to protect staff and to protect other patients around, we decided instead of people just walking in, Let's streamline things. So you call, we prefer you call rather than come into the hospital.
Dr. Helen Tete called on the general public who are interested in both specialist and general health care to take advantage of IMA, as their services are of the international standard and yet affordable.
We have the full complement of service. So from the lab to radiology, you can do almost all your radiological investigations at IMA. CT scan, MRI, fluoroscopy, mammograph, ultrasound, so chest x-ray, it's the standard.
Dental, yes.
And then we have dental services, full running. We have eye services also fully running.
I see.
We have a dialysis. And
She said the International Maritime Hospital has resumed all its expert surgical procedures that hitherto was on a break due to the coronavirus. She recounted a successful neurosurgery that was recently done by a team of medical professionals at IMA, which resonated in the Tema community.
This client was supposed to go to another facility, and yet he was getting more and more complicated. And they had cancelled elective surgeries, and so he couldn't have his surgery done in that facility. And so eventually he came to IMA, and we did the surgery for him, and thankfully he's recovered amazingly, and that was our first craniotomy.
Dr. Tete urged the public to stay updated with information on coronavirus in order not to miss out on vital information that may emerge. The head of IMA, Dr. Yao Opon, also advised the public to accept the possibilities of living with the coronavirus, hence the need for modifying lifestyles.
So, maritime health facilities are indeed helping to prevent the importation and spread of COVID-19. And in addition to what you just heard, IMA is educating the rank and file of the citizenry on COVID-19 in local languages.
Tai fa semna ene insu a etene hohoro nsa na mpo so wo baabi a unya insu ne semna fa sanitizer akoko wom fa gu nsem ne fa pepa nsa ho nyina se wo yare a snefie
edoya epenko coronavirus alo covid-19 no zwe ebe apepela apeko de abomen ke amegi hole okwa hajira o mako odoya o alo azan chisu ape epeko de men ke akwa de bola lugumen
ka ohesa mmawa na ehie eyo kejadbi enyo kashi ochi enyo dani okadie baji amehetu mekome na menye ni okadie kuba amehe shi amehela ni amekenchengemo hela ba chengbo ko hesa nu wata nije mokoni yo hela ko chinemo alo eriomohe
se coronavirus yawe ni biba obi mu a ensencheni a ede edi woni pani mu no ebi ni ewa ahohye se wo home a ensi so minimu kro sipaye widie mu yaw ayemtuo na ebi mu mpo de ba ne se amuno mu ho ara no won hwene entumi nte pampan bi ana se won tetwema entumi ente dew biara.
Currently, coronavirus infection has no vaccine. When you are exposed to somebody who has the infection, you can develop symptoms within 14 days.
Coronavirus dinnan akwai da yawa amma wanda ya fito yanzu wanda zai iya kashe mutum. Amma kafin mu san wai gaskiya mun samu coronavirus, ciwon coronavirus dinnan sai mun je asibiti an gwada an giya mana wai gaskiya muna da shi.
Na obi sa ho se edien na obeye ambra ususu se oni obi a wanya sayare ni bi enye nhyiamu ana se wa ben obi a owo sayare ni bi de se wo ye ni se obeto ohun punu mu na wa frɛ number eda screen no so emra o hye edemu ndadu nan se onya atenka se owidie mu asesa ana se wa pomuden asesa ebi ne se obowa ohome a ensi so ohun ye hye ana se omini mu ye oya obefre wayare sabia ana se hospital na o ma chiro dia esese oye
nto shika wofe ekomiye obanya wosa neke helane na ejake mofia mo ehia nya ha wofia ekomi koni wachi covid-19 na Nike oba sumo, ake oba wabo, ye neke biyani, oba nye ni otra telephone number ni una biyani, nye iradon.
Iron Port returns shortly.
Here's innovation from Goyle that takes you further. New Goyle Super Synthetic 5W20 and 5W30 lubes have been expertly crafted with the latest in liquid engineering technology, highly advanced for modern engines, prolongs oil change intervals, save you fuel, clean, protect and enhance engine performance. The way engines work has become complex, and Goyle has innovated to stay ahead. Expertly crafted lubricants that work excellently with all petrol and diesel engines of today. New Goyle Super Synthetic 5W20 and 5W30 lubes. Innovation that takes you further. Goyle. Good energy.
Dear valued client, the Ghana Trade Hub mobile app is now live to make it easy to track your consignment and know the estimated duty payable for both general goods and used vehicles. We are pleased to inform you that the Ghana Trade Hub mobile app is available for download on Google Play Store for Android users and the App Store for Apple users. The Ghana Trading Hub mobile app is now live. Download and never be cheated. This is powered by the Smart Ports project under the auspices of the Government of Ghana and the Ghana Revenue Authority. Smart Port, improving Ghana's ease of doing business.
Electricity, then pay your taxes. Yeah. Our taxes, our future.
Because you see, without our taxes, we wouldn't have good roads, good schools, better hospitals, street lights, and other very important social amenities. When we pay our taxes, we give our children free and quality education. Talga, my money too small. Why should I pay my tax? Look, small. Salifo, it doesn't matter how small or big your business or income is. You still have to pay your taxes. The little taxes from each and every one of us, when put together, could give your community clean water or that deprived school with tables and chairs. Please pay your taxes. It is your responsibility. It is your civic duty. It is the law.
Oh, how are you?
Hi Yvonne, a few words please. Everyone is talking about the fire at your production house last week. How are you holding up? Has production stalled?
No, not at all. My crew and everyone on my set is perfectly fine because I insure with Serene Insurance. As a matter of fact, I've had all my equipment replaced, including the vehicles that were affected. My workers have been sorted out. Even my production downtime has been covered. So it's all good. I have a meeting to attend to, so I have to get going. Sorry about that.
Which insurance company did you mention?
Serene Insurance, the new face of insurance, a member of First Sky Group.
Next is news and activities happening within the port and maritime industry.
The Accra Metropolitan Assembly has demolished hundreds of structures at the Jamestown Beach Enclave to pave the way for work to begin on the Jamestown Fishing Harbour project. The demolition exercise saw city officials and armed policemen storm the coastal community to pull down a string of wooden structures and other buildings. Earlier in April, the Deputy Minister of Transport, during the official handing over of the site to the contractors, met with constituents of the community to discuss how the demolition exercise can be peacefully executed.
Money has been made available, provision has been made. Anybody here within the area, the geographical area where the construction is going to start, whether you have a wooden structure, block work, whatever, and it's been affected, AMA has taken enumeration. They've counted almost everybody here. So I don't want a situation where you are not part of those who are counted. And you begin to attack my brother Honorable Ajeso.
He revealed that a suitable compensation fee has been arranged for legitimate residents who will be affected by the exercise. However, reports suggest some members of the fishing community who work in the current Canoe Basin are unwilling to make room for contractors to take over and start engineering processes on that part of the site. The Jamestown Fishing Harbour project, which is in 3 phases, is expected to be completed within 32 months. It involves the dredging of about 118,000 cubic meters harbour basin and shipping channels, construction of hydraulic structures composed of berths, seawall and a breakwater, and construction of administration, production and supporting facilities, including an office building, kindergarten, trading market, processing area, commercial area, and other production and supporting facilities.
International port news next.
Three crew members were kidnapped from a tanker at Opobo River mouth, some 27 nautical miles off east of Bonny, Nigeria, on 20th May 2020. At the time of the attack, the Nigerian-flagged Prayo 1 was carrying automotive gas oil from Lagos State to Calabar, sailing very close to shore, Presidium International said. Perpetrators managed to board the ship and kidnap 3 men, the captain, the chief engineer, and the cook, likely all being Nigerian nationals. The crew notified local authorities that deployed NNS Jubilee, a Nigerian Navy ship, to provide support. Following the incident, the tanker sailed to Uta Ewa in Ekot Abasi with the assistance of a local pilot to avoid grounding in the shallow waters of the area. The Port of Helsinki will temporarily dismiss its entire personnel due to the impact of the coronavirus pandemic and related travel restrictions on the port's business. The port said in an announcement that, quote, "Because of this, we have been forced to start extensive cost reductions. As a part of the reduction plan, the Port of Helsinki Limited and its employees have agreed that the port's personnel will be temporarily dismissed," unquote. The decision was made in the cooperation procedures that ended on 19th May 2020. As informed, the personnel of the Port of Helsinki will be dismissed for 30 days between the start of August and the end of the year, and for a maximum of 30 days in early 2021. The management of the Port of Helsinki will participate in the adjustment measures by waiving their holiday bonuses for 2020.
Here's innovation from Goyle that takes you further. New Goyle Super Synthetic 5W20 and 5W30 lubes have been expertly crafted with the latest in liquid engineering technology, highly advanced for modern engines, prolongs oil change intervals, save you fuel, clean, protect and enhance engine performance. The way engines work has become complex, and Goyle has innovated to stay ahead. Expertly crafted lubricants that work excellently with all petrol and diesel engines of today. New Goyle Super Synthetic 5W20 and 5W30 lubes. Innovation that takes you further. Goyle. Good energy.
Dear valued client, the Ghana Trade Hub mobile app is now live to make it easy to track your consignment and know the estimated duty payable for both general goods and used vehicles. We are pleased to inform you that the Ghana Trade Hub mobile app is available for download on Google Play Store for Android users and the App Store for Apple users. The Ghana Trading Hub mobile app is now live. Download and never be cheated. This is powered by the Smart Ports project under the auspices of the Government of Ghana and the Ghana Revenue Authority. Smart Port, improving Ghana's ease of doing business.
Electricity, then pay your taxes. Our taxes, our future.
Because you see, without our taxes, we wouldn't have good roads, good schools, better hospitals, street lights, and other very important social amenities. When we pay our taxes, we give our children free and quality education. Talga, my money too small. Why should I pay my tax? Look, small. Salifo, it doesn't matter how small or big your business or income is. You still have to pay your taxes. The little taxes from each and every one of us, when put together, could give your community clean water or that deprived school with tables and chairs. Please pay your taxes. It is your responsibility. It is your civic duty. It is the law.
Oh, how are you?
Hi Yvonne, a few words please. Everyone is talking about the fire at your production house last week. How are you holding up? Has production stalled?
No, not at all. My crew and everyone on my set is perfectly fine because I insure with Serene Insurance. As a matter of fact, I've had all my equipment replaced, including the vehicles that were affected. My workers have been sorted out. Even my production downtime has been covered. So it's all good. I have a meeting to attend to, so I have to get going. Sorry about that.
Which insurance company did you mention?
Serene Insurance, the new face of insurance, a member of First Sky Group.
Schedules of vessels that have berthed within the port, those at anchorage and those expected in the coming week, including the Bank of Ghana exchange rate. That's it for this week's episode of Iron Port. Thank you for watching, and thanks to the entire crew.